Good morning, everybody, and welcome to our Thursday morning webinar. This is week 15 of our webinars. It's gone so quickly. Thank you all of you for coming. So just as a reminder, obviously, if you don't get the time to watch and you're trying to let your friends know, they are all available on our YouTube channel on Nursing in Devon. Today, as on the advert, we have Tracey Beck with us, who's one of the senior nurses at Torbay and South Devon. And Tracey's going to talk about the wonderful opportunities for international nurses at the hospital and what you might come to expect when you arrive. So please put your questions in the chat box and we will have an opportunity at the end to ask Tracey the questions that you've popped in there. So Tracey, thank you very much for coming and joining us today. It's great to see you. And I'm going to hand over to you.
Excellent. Well, thank you. Good morning, everybody. So my name is Tracey Beck, and my role actually for Torbay and South Devon Foundation NHS Trust is a safer staffing and nursing recruitment lead. So I'm here today to talk to you all about working in Torbay South Devon Foundation Trust, and hopefully you'll be able to see on your screens the presentation that I have presented. So hopefully you can view that. We're just loading that now. So if we move to slide 2. So what I want to do, thank you. So welcome. This is just an example of our international nurses who are currently working with us here at Torbay. And I just wanted to celebrate that and welcome them and welcome you, because it really makes a big contribution to our trust. So this is what I want to do today. I want to facilitate, to talk about working in not just the hospital, but working in Torbay as well, and why we would really welcome you to work alongside with us. So this is just an example of our colleagues working now. So we can go to our next slide. So working in Torbay, I don't know if you're aware, the attendees on the call today. So Torbay and South Devon NHS Foundation Trust is both an acute trust and a community trust. So we have what we call acute facilities, we have inpatients, we have outpatients, and we also have community hospitals. It's really important that we also recruit in our community setting. So what you see on the slide in front of you is a picture of our acute trust. So when I say acute trust, some of the services that we have our ED department, which is our emergency department. We have our surgical speciality. We have our medicine speciality. We have our outpatients. We have our inpatients. But our community hospitals is something I'd really like to focus on as well. So if I can move to our next slide and just talk a bit more about the type of work you would have if you were to join us here at Torbay and South Devon. So it's integrated. So what this means, this is an organisation, a care organisation that provides care for our patients with a full range. So that is acute, community and social care services. So we have 4 community hospitals. We have Dawlish, we have Brixham, we have 4 community hospitals, and we also have health and wellbeing sites. So this is our inpatient and also the outpatient centre. And we also, as part of our trust, as part of our integrated care, we provide care to our patients within the home setting as well. So when our patients are discharged from the hospital and they go home, they still require care. So we do provide that service as well. So we have our district nursing team that go out to our patients and provide care in the home environment. As a residential population, we service a high percentage amount of people in the area, up to 375,000 people. And we do have a lot of visitors as well. So I just wanted to mention that, it's really important when you're a patient and you're going through that provision of care within a hospital setting or community hospital setting, that you have access to your visitors and carers. As I mentioned earlier, we have an urgent and emergency and ED department here in Torbay in the acute trust, and we have a medical services. So lots of services under the medical umbrella. We have a surgical wards, we have maternity as well. So we have the maternity, children and young people, and the community. So again, you can see that that's part of being an integrated care organisation. So if we move to our next slide, you are integrated because we call it an integrated service, because we provide that care to our patients, and they come under what we call an umbrella of ICUs, and this is encapsulates the area Torbay. So Torbay is the area of South Devon. So we have what we call a Torquay ICU, because Torquay is part of Torbay. We have Painting and Brixham. Again, that is part of the Torbay area that you'll be working in. And again, we have our community hospitals in Brixham and in Painton. We have more to see. We have Coastal ICU, and we have Newton Abbot, and we have a Newton Abbot Community Hospital. So you can see Torbay and South Devon is quite a big geographic area as well. So there's lots of opportunities to whether not just working in acute hospital, but working in our community services. So our medical services, that includes general medicine, it includes respiratory medicine, it includes cardiology. We have a really good cardiac unit. We have ICU. We have a renal service. We have elderly care, elderly medicine, and particularly in our community services, really good end-of-life care pathway. We have dementia services. We have dermatology services, we have our stroke services, and we have specialist services like our specialist cancer services, and all of that is provided within our acute trust and our community trust. We also deliver maternity care as well. So our maternity services within Torbay and South Devon include antenatal care, includes the postnatal maternity care as well. So there's a wide range of services, and I really want to emphasise there's a wide range of services here at Torbay and South Devon. We provide inpatient and outpatient clinics, for example, eye clinics, and they're normally based within the main hospital site, but we do have smaller sites which are based in our community services. And the next slide, please. So in our community services, and this is an example here of one of our community hospitals, which you can see is slightly different. So our community services are part of the Torbay and South Devon Foundation Trust Hospital. And this includes community health services. So you could be an inpatient. So it could be, rather than having acute provision of care, it could be within the community services before, say, for example, prior to going to them receiving services at home. So it's not just for adults, it's also for children and young people, and they still do have that inpatient and outpatient services. It could be for dental services, it's not just an inpatient, it could be for urgent care service, and particularly for end-of-life care as well. Also, one of the things that we provide in our community services, as well as the acute, is rehabilitation, that intermediate care nursing, medical care for people with long-term, progressive or life-limiting conditions, and particularly care of the elderly and frail. I think there's some really good opportunities here. We've got really good career pathways. If you were particularly interested in working in our community hospitals, we have a really good education focus and a career pathway, progression pathway for you if that is something you really wanted to focus on and develop into. If we go to our next slide. So our next slide, this is an example of our hospital map. So this is the main acute services. I put this here because I thought this would be quite useful, so you can have a visual view of what the hospital looks like, what are the services, where will I find all these services, where will I find the surgical ward, where will I find the medical ward, what does that look like visually? And as you can see, there's lots of places to park, there's lots of places for visitors, there's lots of signposting. We have a really good education facility called the Horizon, and I don't know if you can see that on the map, and they have really good places, training facilities, and they have actual simulation rooms where you can, for example, when you do your training, it's like you're in that ward environment set up. So for example, if you want to do your resus training, everything's there, the resus trolley is there. There's really, really good, strong facilities here at Torbay. So if we move to the next slide. So this is about our values and our objectives, and it's really important. I wanted to share with you our values and objectives here at Torbay. So the purpose, which is one of our values, and our vision as well, is the purpose of Torbay is to provide safe, high quality health and social care at the right time, in the right place, to support the people of Torbay and South Devon to live their lives to the full. And I think working together, working collaboratively with our social care, with our community care, is something that we really focus on, and that is really central and core to our key values and objectives. And the vision is as a community where we're all supported and empowered to be as well and independent as possible. And that's what we strive to do for our patients, able to manage also our own health and well-being in our own homes, where we need to care and have a choice about how our needs are met. And again, I think that's really important for that patient journey. So our objectives are to ensure that the care we provide is safe, is quality care and the best experience. We will deliver high quality care that is accessible. And this is when I talk about the community as well as acute services. It's really important that we provide care that is accessible for all. It's personalised. It's designed to maximise independence and choice. Choice is really important. It's about having that improved well-being through partnership working, through that integrated working. We will work in partnership with individuals and communities to support them to take responsibility as well for their own health and well-being. It's about value in our workforce, something that part of my role is really important. Part of my role is working with nursing recruitment, is working with our international recruitment, it's working with systems and processes to enable that. So it's really important for retention that we value our workforce and we have systems and processes in place. We will be a great place to work, and an employer of choice, an organisation that actively engage with our workforce. And again, that's about working with career developments, making sure that you have appraisals, that you have pathways. It's making sure that we are well led. It's ensuring that we are working towards a high performing organisation, learning and innovation as well. And there's clear direction and effective leadership. That's very, very important. It's something we strive to do. So if I can move on to our next slide. So as an international recruitment, an international nurse, if you were coming to join our trust, one of the things that you would expect is a really thorough welcome to our trust and induction. And as part of our induction, you will work with the Devon IR Hub, but we also have a team here to welcome you. You have a welcome pack. One of the things we do once you've come through the onboarding stage is we will endeavour to do a number of things. One of the things we do is to meet and greet your managers, and I am overseeing that. I am part of my role is overseeing that. So I'll do an introduction email, introduce you to your managers so that you can meet your new line managers, you can meet your ward before you start. So you're linked with someone, you've got a point of contact before you start. So you understand the organisation, what's expected. Try to navigate the trust, which is, which can probably seem quite daunting when you first go to a new a hospital or a new outpatient or a new community setting. It's really important that you can navigate your way around. It's also one of the things I'm trying to implement is what we call a buddy, a link nurse. So you not only meet your manager, you have a link person. So throughout your when your induction and onwards, you'll have somebody, a buddy or a link member of staff. If you wanted any advice, any signposting, answer any questions. We'll have a tour of the hospital, again, to really understand and navigate your way around. We'll help you with setting up the details of things, setting up your bank account, signposting you to a GP, setting up a dentist, signposting where the local shops are, where the train stations are. That's something we really want to make sure we have a robust onboarding, welcome, induction and ongoing support. You'll have a supernumerary period on your allocated ward. You'll have a really thorough trust and clinical induction. It's really important that all of our staff who are employed within the trust have a really good induction. I think that's key, and we have systems for that. Your OSCE training, so you have a link. We have an education facilitator called Havika, who really support you with your OSCE training. They do preparation for you. They'll be able to give you a timetable. They'll be able to talk you through your exam. All the detail, all the information that you really want to know. We want to make sure that you're fully informed and you have all the information to enable you to go through that process and pass. And again, a really preceptorship program. I put an organisation chart on this slide as well, so you can see where, not only the progression chart where you can progress, because that's what we want to do, encourage you to join our trust and then progress, so you can start to see how the organisation works. So if you're RN, you're a band 5, you've got your sister charge nurse, you've got your ward manager, you've got your matron, so you've got that that support network around you. Okay, and the next slide. This is Havika. So Havika is our education facilitator and our international nurse support. And not only Havika, we have a whole team, but we will help to support you in your training and education needs, which includes preparation for your OSCEs. We do some mock OSCEs as well. Hive is a system. So this is what we call a learning platform. It's just something we use here as an education platform. It is excellent. What it does, it's an electronic system where you can click into it. You'll be given your passwords and your usernames, and this is how you can do that e-learning. So if you had to do the e-learning, because some elements will be face-to-face, but if you had to do that e-learning, remote learning, you would have a username and password to click into the Hive, and then you would just work your way through the program, but you would be fully supported to do that. All of our new employees have an induction period, and they would log on to the Hive, and then that can facilitate them to do their training. For example, resus, infection control, fire, health and safety, etc. And the training timetable would be sent to you. So you work very closely with Havika and her team from the education department. Okay, if you move on to the next slide. So again, it's really important to talk about health and wellbeing, not just our patients, but for our staff as well. And one of the things that we really emphasise within our trust is a really good health and wellbeing signposting. So what I mean by that is there's lots of resources for health and wellbeing. And we have what we call, again, a system. It's called Icon, and this is where you find the Hive. This is where you'll find the wellbeing support. This is where you'll find all the links, all the signposting, to enable you contact numbers, to enable you to navigate your way around the trust. So one of the things we really want to emphasise is our health and wellbeing. We have a really good wellbeing support, and that can be by a phone call, that could be by a link on the intranet. There's always somebody there to support you, and we have what we call a help as well, which is and yes, there's some elements which is also confidential. So if you want to support, which is 24 hours, 7 days a week, we do have the facilities to be able to do that here at Torbay. So that's our health and wellbeing. So our next slide, I just wanted to talk about equality, diversity and inclusion, EDI, which is very important and valuable and key in our trust. What this does is ensure that we have fair treatment and opportunity for all. It makes it to ensure we eradicate discrimination on the basis of protected characteristics. And how we can do that, there's a number of things how we do that. We have policies in place to ensure that. We also have a number of forums and networks. We also have a link member of staff. So if you think about health and wellbeing, we have a link member of staff. If you think about education, we have points of contact, link member of staff, and we have the same for our equality, diversity and inclusion. We have what we call a BAME staff network, and this supports our Black, Asian and minority ethnic staff. And it's really important, and we are committed to creating a fair and diverse workplace. Again, we have this forum provides the confidential. I think it's really important that things are confidential, safe and supportive. We want this for all of our staff. We want them to be able to, if they so require, to have the forums or the networks or the point of contact for staff to come together to share their knowledge and experience, and most importantly, provide peer support. Provide support for each other, work together. It's difficult, particularly as you would appreciate this last year. It's really important that we work together and support each other. We've got somewhere to raise concerns. If we do have concerns, we need a point of contact for that. So it's really important that we know who to raise concerns to and improve our experience of working here. So if we move to our next slide, which moves into our Freedom to Speak Up Guardian. So this is Sarah Burns, and again, our point of contact. So our Freedom to Speak Up Guardian, we have this facility here at Torbay. Every employee should feel able to raise concerns, and every employee should be confident in the knowledge that they will be listened to. I think it's really important that our colleagues and our staff have the opportunity to feel listened to and to be heard, and also to have assurance that action will be taken. So if you feel you need to raise something, first of all, you're listened to and that action will be taken. And again, that's something, you know, that we really want to ensure that we have an advocate for this, an advocate, a voice for our staff. And that's also part of my role. So this is Sarah, who, as part of your induction, all of these people you would meet as part of your welcome to the trust. Next slide. So I just wanted to quickly talk about Pathway to Excellence. This is something that we've embedded within Torbay. Torbay Trust is one of only 14 pilot sites nationally to be supported in the Pathway to Excellence accreditation. And what this is a set of markers, a set of, so each ward will have a set of standards which they have to adhere to. So we have a Pathway to Excellence lead. They will come into each ward at a set time. It takes quite a while. I think it's probably about half a day, but we will go and look and work with our colleagues on the ward, look at a set of standards. Are you safe? Are you well led? Are you caring? And then they would get a standard, whether they're gold, silver and bronze. And this is really important. This is about looking at accreditation. This is ensuring that the services that we provide are provided with excellence. So we're just one of 14 pilot sites. This will enable the organisation to become accredited. And again, this aligns with the Chief Nursing Officer for England, Dr. Ruth May's vision of the 3 priorities. It's about having that local ward accreditation. It's about the nursing and midwives excellent. This programme will allow us to show and work towards these standards. Thank you. If we move on to the next slide. And I just want to go briefly into living in Torbay. It's not just working in Torbay and South Devon, it's also living in Torbay and South Devon. So just to say, if you were to join our trust, we'll also provide you with accommodation on site or very close to the hospital base. We will ensure that the accommodation is available for 4 months from arrival, and this will allow you time to settle, also to complete that OSCE training, to complete that induction, and time to adjust. Like I said, you're adjusting to a new trust, a new hospital, new surroundings. We'll also provide you with full information on the bus and the train travel. We have local facilities to train stations very close to the hospital and the bus as well. Even if you're working in the community services, there is public transport available if needed. And also the supermarket. It's really important that you have you can navigate your way around the supermarkets near the hospital, of which there are many, and also local places of worship. And if you go to our next slide, this is just again, this is just our colleagues here in Torbay and South Devon. And I just wanted to demonstrate with this picture, you'll have a wide network of colleagues as well. So that's what we want to do. We want to make sure that you feel welcome and you feel that you have support working here in the trust. Okay, and our next slide. So our next slide is just about just finishing really on about Torbay, just to say that working in Devon, it does offer that combination of working in the city, living, as well as the outdoors. So you have the coast very close to you. You have the countryside, you have Dartmoor, you know, there's lots of things within the facility. So you have that work-life balance. So it's really important, you know, if you come to work here in Torbay, that you're aware of what Devon has to offer as well. And just to say that if you share our values and visions we've spoken about and you're passionate about working with people, you'll be an absolute asset to us here at Torbay and South Devon. And I just wanted to finish with a final picture of our colleagues here in Torbay. And just to say thank you. That's really important because it's a really valuable contribution that makes a difference to our trust. So thank you.
Thanks, Tracey. That was great. What a lovely photo to end with. That's
it is. Isn't that lovely?
Really good. And yeah, really good presentation about Torbay. We've had some great comments saying I'm already in love with the hospital, so that's really nice. So I just wondered, Laura, are we able to just put the values slide on again? We've just had a question just saying they couldn't quite see the values. So Tracey, would you mind just going through them again? Is that all right?
Yes, of course. Yes,
Thank you very much.
Yes.
I don't know if we're able to enlarge that at all.
Trying. Is that better?
Yeah, that's a bit better. Yeah.
I can read them. So our purpose is to provide safe, high quality health and social care. That's really important. That's that integrated at the right time in the right place to support people in Torbay and South Devon to live their lives to the full. The vision is as a community where we're all supported and empowered. I think that's really important, empowered to be well and as independent as possible, able to manage our own health and well-being in our own homes. When we need care, we have a choice. I really emphasise that about the choice, about how our needs are met. It's really important that patients have a choice about where their care is provided. And the objectives is about providing safe quality care and the best experience is about improved wellbeing through partnership working. So that's that integrated care, valuing our workforce. It's really important that we value our workforce and retention is something that I'm particularly working on and making sure it's well led. We have good leadership. And for me, that's about making sure we have good career pathways. And what I mean by that is when you come to work for the trust, you need development. You need to know, what does that mean for me? What's going to happen in a year's time? What's going to happen in 2 years' time? You know, if I've got aspirations, what does that mean? Who do I need to contact? So WOW-led is really important. Thank you.
That's great. Thank you, Tracey. And I think our values and objectives, it's something we've always been really passionate about in the NHS, but I don't know about you, but since COVID, it's something that's really been focused on in terms of our staff wellbeing.
Yes.
Obviously, you know, staff have worked through the pandemic globally, and the NHS really recognises that. And there's, you know, for me, I think there's more support there for staff working in the NHS than there ever has been before. And I know you talked about the health and wellbeing offer there.
Yes, you're absolutely right. Thank you, Carly, for mentioning it. Yes, I just briefly spoke on health and wellbeing. I think health and wellbeing is key. As you said, the last year or year and a half, I mean, we've been very reactive. It's been very difficult times, and I've been working hard. So it's really important that we recognise that and we value our employees. And that's when I talk about retention, keeping our employees. So we need to make sure we have a support mechanism to do that. So, and not just one support mechanism. So well-being, that could be someone you can talk to, someone who would listen. So, and it's not just a service. We want our managers to be like that. We want our colleagues. We all understand, we've all worked alongside you, and we know what it's like to work, you know, during COVID times, or even not during COVID times. We know what it's like to work a night shift, for example, what it's like to work the weekend, what it's like to work in a busy ED department. It's really important that we recognise that as managers and as a trust, and we use different ways to do that. So it's not just a contact number or you know, a website. It's also about having engagement events. So this is where someone like our Speak Up Guardian is really good. We have listening events where we go around to the wards, and we listen to what staff have to say, and then we take action. You said we did. So you said, you know, I don't have a nice area to have my break. You know, I need some time to, you know, when I have a break, I need some time out. So you need to do some action. You said we did. And I think you're absolutely right, Carly. We've really had a focus for all trusts nationally on staff wellbeing, because it's key. It really is key.
Lovely. Thank you, Tracey. So the next question is, what specialities of Torbay is needed at this time? So where are you recruiting international nurses? What posts are you recruiting into at the moment?
We're recruiting for all specialities, in particular our emergency departments. In particular, our community services. I really want to showcase our community services as well, because previously I've worked in a very large community services, and I think you know, working in the community services, working in a rural area, I think, you know, it's a very collaborative working. I think you have to be highly skilled to work in those areas. So there's lots of development opportunities. I would say the vacancies at the moment is across all of the services, but in particular our emergency services, our elderly care, our medical, and also our community services. But I would encourage all, because there's so much opportunity. So for example, if you wanted to work in the medical but you had an interest in cardiac, for example, the opportunities there. So you might start off in a surgical ward and then might want to go to a medical ward. So it's about understanding how the hospital works. But yes, we have vacancies across the specialities, including maternity and children and young persons.
Thanks, Tracey. And obviously, like you said, we do try and match people up with their areas of expertise.
Yes.
So next question is, this is a very interactive webinar. It's great. We're up to just under 50 attendees watching.
Great.
So someone's asked, how is the continuing education while you're working like? So I guess it's what sort of educational opportunities may be available to international nurses once they've got their PIN number. So I just wonder if you might be able to talk a little bit more about that.
Yes, we have. Again, I would really like to showcase our education team. So Havika, who I showed you on the slide, is our education point of contact. So what will happen is, obviously, when you come to our trust, you would go through the OSCE process, and we sort you of induction and your mandatory training. But for me, it's really important. I still say that career pathway. And what I mean by that is, it's really important when you come to our trust, you're employed by our trust, you know what development opportunities are. So that would be individualised, it'd be tailored to your need. So if you were, for example, a band 5 nurse working on a medical ward, but you wanted to specialise in cardiac, if I choose that again, in the cardiac unit, we would tailor, we would look at what development needs would you need. Would you need a training course? Would you need to do some taster days? Would you need to do some shadowing? Would you need a university course? Would you need a module for that? So what that is, you would work with your line manager, you would work with your supervisor, you would work with someone like Havika, you would work with your education link to really articulate what it is you want, and that will be tailored for you. You'll have your generic one. How do I get from a band 5 to a band 6? How would I get to a band 6 to a band 7? And you would have your generic training, your leadership courses, your managerial courses, your in-house courses for things like how to manage staff, how to do appraisals. But you have that specialist element. If you wanted to work on certain aspects, you know, that's when you start linking with your universities and your modules. But I'd say that needs to be tailored for the individual. And again, I think it's really important you know that right at the start. So that's something as part of your appraisal, your PDP, that'll be worked through. So you know what your objectives are and who you need to contact to enable that. Hopefully that was okay, Carly.
Very good. Yeah, thank you, Tracey. And obviously the preceptorship course is offered to the international nurses. So just a question for me, is that the generic preceptorship course, Tracey, or is there one that's especially for our international nurses?
I probably need to find out the answer for that. I know there's definitely a preceptorship course for the international nurses, so it's probably tailored for the international nurses. But yes, it's a good question. Again, we've got a preceptorship team as well.
Yes.
Yeah.
So another question's come in. So how long does it take to induct new hires into the trust?
Oh, good question. I know. If you wanted to know, did you want to know the exact time from sort of onboarding? Sorry, Carly. Is it so when you start?
I think the way I've perceived that question is, how long does it take for a nurse once they've arrived and got their, you know, from arrival to being up and running and working independently in a clinical area? That's how I've read the question.
Yes. So obviously we've got sort of the COVID period, isn't it? The isolation. So once you're actually working and you start on the ward, you have what we call a supernumerary period. So supernumerary period means you'll be working alongside someone. So you'll be actually working on the ward. Obviously during that period of time, I think it's 4 months. So during that period of time, you'll be again navigating yourself around the ward, understanding the hospital, you'll be doing your OSCE, you'll be doing your induction. So that's why you don't go straight into working without someone supporting you. So under that umbrella of supernumerary, this is your opportunity to really embed yourself, to understand what your role is. So you have that 4-month settling in period, you'll have a link person, you'll have your line manager, you'll have your OSCE. So we really wrap around that support mechanism forward, because you'll have your induction. It will take, when I say induction, your mandatory training, you won't do it all in one day, so you take a couple of weeks. So that's why we call it a supernumerary period. And I think I said it was 4 months. I think it's 4 months. I don't think it's on this one. No, it is 4 months. I've just been updating the welcome pack.
Great.
So it's 4
Thanks,
months,
Tracey.
and that's your opportunity to really settle in the role.
Yeah, and I would absolutely agree with you. You know, it takes a considerable amount of time for our international nurses to settle into our clinical areas, and our managers are very aware of that, aren't they?
Yes,
You know, to be up and running, and that's the same for any new nurses. You know, our
oh,
newly
of course,
qualified
it's the same.
nurses.
Yeah.
So you're not alone. So we've had a really good question. I think this could be the question of the day. So
Oh,
someone has
hopefully I
asked,
can answer.
what is the nurse to patient ratio in your trust?
Oh, that is a good question. Yes. Right. So it depends. It depends on the ward. So I'm going to give you quite a long answer. It's not a quick answer. So in Torbay Trust, we use a system called an health roster system. It's an electronic rostering system. So what that means is if you're coming to work a shift, an early, late or night shift, you would be put on a system, and we would be able to see from this system each day on a ward, for example, say if I was on I don't know, ward A, I would know that I've got 2 trained on today and 2 healthcare assistants, and I can see that, and we look at this data twice a day, every day, and I'm part of that. And what that data also tells me, if I've got 2 and 2, it tells me how many patients I've got on the ward. So say I've got 20 patients, and then you would know that you've got 4 staff to 20 patients. So you know what your ratio is. 4, 8, 12, 16, 20. That's 1 to 5. But that's healthcare assistants. And so each day we can see what our nurse to patient ratio is, and we can see our staff on duty, and we can see if we've got staff that, for example, that are poorly and we're a nurse down, so we've only got 1 nurse instead of 2, we work collectively as a trust to see if we can allocate a nurse to ensure that their nurse to patient ratio does not increase. And that's something we monitor twice a day, every day, to ensure that our nurse to patient ratio doesn't fall below. And then we score it. Are we red? Are we amber? Are we green? So that is something that we particularly, Carly, focus on every single day, and particularly in my role, is to ensure that our nurse to patient ratio is in line with national guidance. Yes, if you've I don't want to be too technical, but if you talk about acuity, so if our patients are more poorlier, you need more nurse to patient ratio. So that's what I mean, depend on the ward. If our patients are in an elderly ward, you're going to need more nurses to patient ratio. Obviously, if they're in a different setting, you might need less. So it's depending on the ward is the answer, but it's a very good question, and it's something that we monitor and focus on each and every day.
Thank you, Tracey. And I know from obviously I'm working with the Devon IR hub, but I've worked in North Devon for the last 10 years, and I know what you've just talked about in terms of safer staffing and looking at the acuity of patients is looked at almost every minute of the day, isn't it, by the senior nurses, and staff are placed based on patient need, because patients are at the heart of everything that we do, and patient safety. So I hope that provides some reassurance about the amount of governance that we have about that. But the lady, Cynthia, that asked the question, I just wondered, Cynthia, what's your nurse to patient ratio where you're currently working?
Question.
We'll see if she pops up in the chat about that. So one of the questions I know you touched upon it in terms of living in Torbay and the beautiful area. You know, you're near to the coast, but you're near to the countryside.
Correct.
You know, quite a lot of our nurses will relocate on their own to begin with and get their OSCEs and PIN numbers, and then they will bring families over. So I'm just wondering what sort of local communities you have in terms of our international nurse workforce in Torbay.
Yes, and that's why I wanted to put some pictures on the slides to demonstrate that we have a really good community network here at Torbay, and working with your colleagues, they'll be able to signpost you to that as well, because that's what we want. We want to encourage not only our international nurses to come and work at Torbay. It's about living at Torbay, and it's about having a family orientated place, and we have that community network, that support network, that peer network to support that. It's really important. We do have lots of facilities here. It's a large geographic area. I talk about the coast as well as the countryside, as well as places like Dartmoor, and it's about having that community focus. It's about having the places of worship, and it's about having a variety, because people have different needs. So it's about signposting you to the different communities and the different hubs for that. Probably need to send some information afterwards, Carly, if that's needed, about Pacific communities. We can also add that to our welcome pack. In our welcome pack, we provide specific details of each and every supermarket, each and every place of worship, where our communities are, because even though we say Torbay, if you're working within our community hospitals, it might be quite a distance. So that's why we need to understand, what are the places of worship, where are our communities, where are our shops. So it needs to be tailored to where you're living, because it's not, I'm trying to think of somewhere different. If you were working in, for example, in Hampshire Hospital, it's a very smaller geographic area, so everything's in that environment, whereas here it's a lot bigger. So again, all of that information is contained within our welcome pack, and that's why we're always updating our welcome pack, because we want to make sure we give as much information as possible.
That's brilliant. Thank you, Tracey. I think that's all the questions, and yeah, we've gone up to 51 people watching, so, and some really
Fabulous.
Great engagement. Fantastic presentation, Tracey.
Thank you. Very welcome.
And we've had some great feedback that they're already in love with the organisation, so that's good. So
Great.
I think just last question for me is, what's the biggest thing you love about living and working in Devon?
That's a good question. For me, it's my colleagues. It's the values. It's the values of the trust is the main thing. So it's about that So it's going to be a long answer again, Carly.
Okay.
Sorry. It's about working collaboratively. To me, that's really important. That integrated service, to me, is putting the patient at the centre. It's having access to services, not just the acute, not just the community, and also our local services. For me, it's about my colleagues, my working colleagues. It's about that collaborative services we provide, that collaborative working together. It's how we're supporting each other. We are supporting, we're working, and we're striving to support each other. We're really prioritising health and well-being. And also, I think living in Torbay, gosh, where do you start? There's so much opportunity here. There's so much. It's so good, for your well-being, because you've got so much to see and do. You've got the coast, you've got the countryside, you've got Dartmoor. There's so much opportunities here, and also I think that's really good for your well-being. So for me, it's about that collaborative working together for my colleagues, but also that services that are provided for our patients, which I think is really important.
Lovely, thanks, Tracey. And I think for me, the best thing about living and working in Devon is the fact that after a stressful day, within 10-15 minutes, I can be on the beach walking the dog.
That's right.
Or in the countryside walking the dog, and the benefits of that in terms of mental health and being able to de-stress is just wonderful. I wouldn't want to be anywhere else. So thank you, Tracey. That's a fantastic presentation. So obviously we've recorded all of this session, and then we upload it to our Nursing in Devon YouTube channel, which is, and we've got all of the webinars on there. So this is week 15.
Yep.
And a huge thank you to our attendees. We've had some really, really good and engaging questions this morning, and that's just fantastic. So a huge thank you to everybody that switched in. Please remember, tell your friends about us. Yes. We're on Facebook, we're on Twitter, we've got a YouTube channel. I noticed Jack's just put the links in the chat. So when you see us on Facebook, give us a like, give us a love, and give us a share. So I'm going to give you 5 minutes back of your life this morning. So next week we have a recruitment focus. So that will be advertised in the next couple of days. Yep, so you'll be able to come along with your recruitment questions and speak and see the wonderful recruitment team that you probably already know. So again, a huge thank you to Tracey for joining us this morning.
Thank you for making me feel welcome.
Oh, no, it's a pleasure. And we will see you all soon. Take care, everybody. Bye.
Okay, bye-bye.
Bye.